What are the ethical principles that we should be governed by when we communicate with our patients? Within the profession, we all know that the overwhelming majority of dentists are extremely ethical and very altruistic. We all want to help the patient, and the patient's benefit is absolutely top of mind. We certainly never want to be perceived by anybody as being somehow manipulative. It's important that we have this discussion because even though currently your practice might have no issue with this topic, if a new team member were to come in and they have the feeling that the purpose of the communications training is somehow to manipulate the patient in order to have a financial gain, then that would be very damaging, and it needs to be discussed and corrected in advance so it can never become a problem. In terms of the intention of our discussions with patients, it certainly would be manipulative to steer the patient to do something that's for our own personal gain. But if we're trying to do something that's for the patient's benefit, then there's no doubt that we are being ethical educators. On what ethical basis should we even be deciding of what we think is best for the patient? How do we make that judgment? The answer to that question comes from the old biblical saying, which is, "Do unto others as you would want to have done unto yourself," which is if you had their teeth in your mouth, which mightn't be always a very pleasant thought, but if you had their teeth in your mouth, what would you want? What would you do if that was your condition? That's the first question to ask. But there's an extra element to this question, which is, if you're looking at patients and making a diagnosis based on your presumption as to their ability to pay for the treatment, that's unethical because now you're making subjective prejudgments, and this could be distorting your clinical judgments. So we have to diagnose as if dentistry were free and allow each patient to make their own choice. We're able to see into the future. We can see where they are now, and because of our training, we can also see where they're heading. Most patients make their judgment only on where they are now. It's our ethical obligation to have the patient see the future also. If we can do that well, then we're not responsible for the patient's choices. If they understand what will happen with suboptimum treatment and they still choose to do less than what is ideal, then we are not responsible. In summary, diagnose each patient based on what you would want for yourself. It's unfair to diagnose based on your perception of what they can or can't afford. The most critical piece of information that the patient needs to know is what will happen in the future with whatever they choose to do. All team members need clarity as to the ethical policy of the practice so that there's never any doubt as to our main purpose, which is to have the highest ethical standards.